Greetings, everyone. Thank you so much for being here. It's wonderful to see you here for this research committee sponsored satellite session on the topic of mistrust of public health institutions. My name is Melissa Salm. I'm a medical anthropologist and a postdoctoral fellow at Stanford University, as well as a member of the CUGH Trainee Advisory Committee and leader of the CUGH Research Committee's working group on addressing mistrust and skepticism towards science. On behalf of my colleagues in the research committee, I'd like to thank you all for being here today. This satellite session brings together an international group of experts and to discuss the problems of public mistrust of social and political institutions, particularly in relation to global health issues like vaccine hesitancy, perceptions of science, and the authority granted to scientific expertise in recommending preventative practices and policy directions, the spread of health-related misinformation, and the proliferation of social media-driven conspiracy theories. Our objective for today is to take a critical look at these disparate phenomena through the lens of trust and trustworthiness. We invite you to consider, with open-mindedness and an appreciation for nuance, what are the reasons or the drivers behind rising trends of mistrust of institutions that promote global public health? What kinds of relationships do we as members of the global health community currently have with the public whose health we aim to serve? How do institutions like science and public health in the service of policy become trustworthy to begin with? And what institutional changes are needed to rebuild trust where it has been lost, or to maintain trust among those who have not yet lost it? I'd like to just review briefly our agenda for today. We will begin with a moderated discussion on COVID-19 information and institutions. This will be followed by a breakout session during which you in the audience will be placed into smaller groups and have an opportunity to discuss and react to the preceding dialogues, as well as to raise additional questions. After that, we will reconvene as a larger group to highlight insights and anecdotes from some of those breakout sessions, and then we will take a 10-minute break. After that break, we will resume with our second moderated discussion for today on the topic of conspiracy and controversy more broadly. That will be followed by another breakout session, a reconvening, and then concluding remarks. I'd like to emphasize that this event is a two-day event, and we had our first meeting yesterday. And it has been organized to facilitate ongoing conversations about a problem that everyone here in some shape or form perceives as important and troublesome. Our premise is that there is still so much to learn about how to think about the problem of trust and mistrust, and that it's necessary to think about it and talk about it together so that we can figure out what to do about it with open-mindedness and with sophistication. I wanted to share briefly some of the key takeaways from yesterday's sessions, where we had moderated discussions on vaccine hesitancy and perceptions of science. So yesterday, these were some of the key takeaways, mostly from the breakout rooms, which is a testament to how important it is and how much we value the participation of you in the audience. So some of the key takeaways from yesterday were that we shouldn't necessarily de facto insist that skeptics are wrong or misinformed because they're ignorant, and that they should just automatically trust people who are in positions of power. Rather, we should learn about the legitimate reasons why people are mistrustful of institutions, and then doing so will allow us to respond to those problems directly. We also talked about how reasons for mistrust often have to do with social and political values, not necessarily with, arguments over what is true or not true. I mean, even that in itself, there are social and political motivations for believing in investing in that. And so it requires taking a holistic approach to address moving forward. We also talked about key questions that we want to keep in mind for our discussions here today, but then also anticipating the continuation of these academic conversations moving forward. What makes an institution trustworthy? And what institutional changes need to be made to prevent mistrust in institutions moving forward? Finally, something that also came up yesterday was the need to include insights from social scientists into global public health research and response efforts. So with that, I'm looking forward to learning about our key takeaways and insights from our meeting today. At this point, I'm going to hand over the microphone to my colleagues and co-organizers here today, Mariam Mousy, and then later, Gabriel Dorth, who are our moderators for the two sessions today. Both Mariam and Gabriel were members of the audience at last year's Art Research Committee sponsored conference session, and they've become dear collaborators since then. And so in the spirit of ongoing conversation, if you'd like to get involved with our team, please reach out to me via email at the end of the event. And on that note, Mariam, take it away.
Thank you, Melissa. Greetings, everyone. We are delighted to have the contestant today. I am Mariam Mousy. I work as a quality and safety consultant and as well educator for healthcare students in the University of Toronto. We are delighted to have you here, our doctors. I start with Dr. Qingpeng. QP Zhang is an associate professor in the School of Data Science at the University of Hong Kong. His research spans healthcare data analytics, medical informatics, artificial intelligence in drug discovery and network science, as well as the possibilities of big data to support conventional epidemiological techniques and help future public health efforts. He recently served as on commission teams to combat the COVID-19 pandemic by the Ministry of Science and Technology of China, the Chinese Academy of Sciences, and the Chinese Academy of Engineering. Dr. Paulo Fonseca is an adjunct professor at the Federal University of Bahia at the Institute of Science, Technology, and Innovation, as well as in the multidisciplinary graduate program in Culture and Society. He is also a senior researcher at the Laboratory of Digital Humanities at UFBA, where he currently coordinates research about the spread of information in Brazil, particularly vis-a-vis the mobile phone application known as Telegram. His expertise in the area of science, technology, and society studies ranges from policy analysis regarding scientific and technological innovation to studying the social and political implication of emerging technologies and digital methods of social research. Dr. Wibool Piyawattanametha is a professor at the Department of Biomedical Engineering and a director of the Advanced Imaging Research Center at King Mongkut's Institute of Technology in Ladkrabang, Bangkok, Thailand. He is a prolific author and public speaker. In 2013, he was selected the World Economic Forum as one of the top young scientists under the age of 40 who plays a transformational role in integrating scientific knowledge and technological innovation to improve the state of the world. He recently served on two committees for the National Academies of Sciences, Engineering and Medicine, NAS, in Washington, D.C., to address misleading information about biological threats through scientific collaboration, communication, and engaging in trusted scientific networks. Welcome all. Our first question is that, out of your expertise as scientists who research the spread of information in virtual communities and its relation to trust in scientific and political institutions, I would like each of you to respond to the following question in one or two sentences. How does an institution and the information it shares become trustworthy? If we start with the QP.
Yeah, sure. So since I'm a data scientist, so I would say let the data talk, or we can extend it to let the science talk. So the information publication should be clear and timely, and it is scientific, based on scientific evidence. Yeah, I think that's my 2 points. That's my 2 sentences for the point. Thank you.
Thank you. Wibool?
Sure. I think the to gain trustworthy, the institution has to be trustworthy themselves and actually acknowledge the expert in the relevant field. And the other one is the transparency, right? Trustworthy institutions should be transparent about their methodology, data, potential biases, or conflicts. Thank you.
Next, Paulo.
Sure. It's a pleasure to be here to begin with. I'll just say that I agree with my colleagues here, but I would add that it's important to look at situate the cultural context, because trustworthiness is situated. So basically, I don't think there is a general formula for that, because it depends a lot on specific historical and cultural situations that each institution faces. I would be glad to provide examples from here, from Brazil, but since it's 2 sentences, I'll stay here. Thank you, Maya.
Thank you. Well said. Indeed, that was discussed as well yesterday. How was the information, and there is a need for transparency and cultural related and consideration of the culture as well, and to be on time. Timely information is needed. Now we go to the question number 2. When we talk about COVID-19 information, and this information was available and shared by the public, so how the public health experts and policymakers use this information to make their decisions in an unprecedented access to data, particularly through data science. Did it support their decision-making when they responded to the pandemic? And what's your respective context in this?
QP, why don't you go
QP first?
Okay, sure. So from the COVID-19 pandemic, it was probably the first time that people actively utilize more general data science, like because we have a large amount of data that was not available in the past. So for example, the human mobility data, especially the international travels, that people use those, actively use those data from different fields and use those to build mathematical models and use models to derive evidence that can inform timely control measures like travel restrictions and others. So although at the very beginning, it was not as successful as what we would have expected, for example, but but that is also like when we're talking about mistrust, there's also mistrust among scientists. So for example, in February, so our team, we submitted a paper saying that reproduction number of the coronavirus is over 4. People actually in academia didn't believe it because that is far too high as compared to the previous SARS-1, which was something like 2 point something. So at that time, in general, the public health community had a consensus that this reproduction number is something between 2 to 2.5. So when people like us, that we are not traditional public health researchers, when we provide our data-driven result, which was derived from the human mobility within mainland China, that actually people didn't believe it, and we were actually criticized by a few scholars. Yeah, so even within the scientific community itself, we had mistrust, and we had, I would say there's barriers across different disciplines. So I would say the reaction was a little bit laggy, especially when we are considering the spread, for example, to the US and to a few other countries that they can have much better prepared with those early scientific evidence. But still, this was the first time that people actively use data and use mathematical models and trust mathematical models and realize the potential of data and data mining and data science in general in different stages of the fight against the COVID-19 pandemic. So yeah, maybe in the next phase of new viruses and new emergencies, those kind of techniques, they are not in vain. Even some methods didn't actually have the expected consequences, but those methods, those a suite of data science tools could be quite useful in the future. Yes, so thank you.
And how the public health expert, to QP again, how the public health experts use this data to support their decision making?
For one thing, I think after 3 years of pandemic, those kind of data science approaches have been much more welcomed by traditional public health researchers, and people realize that public health is indeed itself is a big data research field, considering like it's not only about the virus, but also e-com, like supply chain and transportation. So it's the integration of multi-model data to deal with. So within academia, I would say from our experience, our research is getting more and more appreciated by the community, and many data scientists are recruited by those top public health schools. So scientifically, I would say public health researchers are now more welcoming data-driven research. And also revolutionizing their traditional research approaches, and especially those leading ones who actively like advocate for like social medias and others. So yeah, so I would say that at least for research and methodology wise, it is now heavily integrated into the traditional approach. And for public health decision makers, similar things. For example, we provide quite a lot of decision support through, not through CDC, but through the Ministry of Science and Technology of China. So we are like we are kind of a team as the so-called information science team for combat for the combat of COVID-19, and they are also like public health team. So yeah, so for public health decision makers, probably they should open a channel to hear different opinions from not only CDC or public health, traditional public health voices, but also be open-minded to the insights from the other experts. Yeah, thank you.
Can we hear from Paulo? Same question.
Yeah, well, I'm not really a data scientist, and I dialogue.
But you can comment on the.
Yeah. I would prefer to, if you don't mind, Marian, I would prefer to to comment on a kind of inverted situation that we have lived here in Brazil,
Yes.
where when the last government we had, it promoted what we called a policy of wishful ignorance, and this was also related to data from all kinds that you can imagine. For example, we had an open initiative for the government to not provide any data from the deaths, the daily deaths that we had. And so we had some kind of citizen science initiative to get data and let the health researchers to investigate what was going on. So what we had was a consortium of press and independent researchers to go at each one of the health secretaries of each one of our 26 states in Brazil to get this data and to build this trustable database that would be notified by mainstream media and would work as a counterfact for the government itself, because the strategy of the government was to not tell the people how many people were dying every day. So I think this is just one other side of how much data science can contribute to health policies when you don't have a government that intends to advance in this area, which is so important, as Qingpeng already told us. It's so important, especially to future research on global health.
Thank you. Wibool?
Sure. Actually, I like to some these my colleagues speak conversations up that actually when discussing COVID-19 information, both public and expert can use various sources of data, and they should stay informed and make decisions and communicate with others. In terms of public itself, they actually can access any information anywhere, but they have to make an informed decision, right? Using the right information in order to make the informed decision. And they actually, as a public themselves, they should be able to actually share the correct information for their peers, their colleagues, their families. And in terms of experts, I know there are lots of hectics even in my home country, right? The government actually issue some of data which is actually not correct about the efficacy of the vaccine, which is actually boasting to be over 97% of all the vaccine, which is totally ridiculous. Sorry to say that. But well, as an expert myself, we need to make use of various information that during the research at that time, which is pretty limited, right? And actually, as me actually on the team of the COVID-19 policy recommendation, we have to actually use that informed information to actually provide it to the government. And also, as a scientist, I think it's everyone's job actually to actually help providing the correct information. I mean, you cannot argue that, oh, there's social media, this, social media, that. And as an expert in the field, you are not doing anything, right? I mean, you have to be there and actually fight with those mis and disinformation. And lastly, you need to monitor and actually evaluate using the tracking the progression of the disease, because this is a gigantic pandemic, right? And that's all I have. Thank you.
You mentioned the availability. Was there any unintended consequences of this data availability?
You mean the data that claim the vaccine to be like over? So some of the experts actually pointing out. So the government itself have to retract the information from the web base, which in a way this is a misinformation in kind of good way, right? It's actually attracting people to come and get more vaccination. Yep.
Thank you. Very interesting. Now we move to question number 3. Is there a meaningful difference between the problem of mistrust of institutions and that of the problem of misinformation, as we tackled in the last question? So, is there difference between mistrust of institutions and the problem of misinformation? And how does it impact the global health efforts moving forward? Paulo.
Yeah, sure. I think those are two different things which are very interrelated. We should not forget that distrust in science does not necessarily come from disinformation. When we were from the global south, we are used to have some kind of scientific advancements that are not necessarily good for the poor population or the global population, the global south population. And these may, in some instances, with some cultural context, promote a shared distrust among specific scientific institutions that should arrive in different areas, not only health, of course. But when you talk to, when you come to the reality of COVID-19, then we should, of course, bring the disinformation, and not only misinformation, but overall, I think disinformation as one of the main sources of distrust in science. Because, of course, when you have massive campaigns for telling people that vaccine is not good, and of course, based on all kinds of disinformative and false, not only false, but also very biased opinions, of course, it will promote a great sense of distrust in many institutional authorities. So what we see that in the debate of COVID-19 in Brazil was precisely an inflection of what we could call a cultural understanding of science here. We had many publications before the arrival of the extreme right here in power, that we didn't have a serious problem with distrust in science. By the contrary, we had a population which used to put the scientists among the high trustful expert professionals in the country. And we, in a matter of 2-3 years, we have changed this situation with massive campaigns using digital platforms, with this what we call is an extended multi-platform disinformation ecosystem. They have actually been successful in inseminating a distrust, for example, in vaccines in Brazil. We had 95% of the population absolutely trusting the vaccines, because it was a very well succeeded health policy here. And with the, I repeat, it's a strategy, it's a massive campaign of building this distrust. And they have been able to actually construct a sense of distrust among vaccines, which nowadays there is some research here in Brazil that it's among 1/4 of our population, which was unthinkable just 4 or 5 years ago. But we should not forget that these, even though they are very interrelated, they're two different things. Not necessarily the distrust comes from disinformation.
Thank you. Wibool?
Okay, sure. So the mistrust, I think it's a global issue that actually can be the hindrance for actually moving the global health prevention forward. And to actually do that or prevent that, I think the institution has to have transparency again. I think should be an issue that we should work all together. And we also need to actually help improve the public engagement, because, for example, my institution is a big institution in Thailand, and scientists actually we have a little tiny task force that help make a little defense and actually issue correct and good information about the COVID-19 during that. And we need to promote media literacy, right? encouraging critical thinking. I think that's the main issue, that why public mistrust in many institutions, because they could not, think carefully and possibly think wider than themselves. And that's actually have been actually a big issue, right? Because that is what we call the critical bias, right? And the other one is we have to actually address the social determinants of health, tackling the underlying social and economic political factors that actually help creating or contribute to disparities here. And that will actually help reduce the mistrust. So all in all, I think we need to work together. This is not the disease that a single country can work alone anymore, right? We have to share data. We have to help one another. We have to actually help make an informed decision. Chair, thank you.
QP.
Thank you. I would echo Paulo and Wibool's most of their comments and points. And Hong Kong is a special place. So our observation here is that, so first, of course, there is difference between mistrust and misinformation, but there are those overlaps. And very often misinformation got exacerbated by the mistrust of the institutions. And here in Hong Kong is quite special because COVID-19 came right after multiple months of social unrest here between the citizens and the local government. So I would suggest that for a lot of this mistrust, because for misinformation and the rumor and the conspiracy theory in computer science and data science, we can analyze the provenance of this information, how this misinformation or a meme or a rumor evolved from different sources and different kind of a conspiracy mindset or there's a worldview. They got combined together with certain facts and eventually became a conspiracy theory or rumor, those kind of misinformation. And similarly for the mistrust, they also got a root. It's not just about the COVID-19. Like in Hong Kong, it was deeply associated with the social unrest in 2019, which is also deeply rooted in the social disparity and a lot of social factors of health, just like Wibool just mentioned. So, and if we compare the case in the US, similar things, it is quite closely related to the political disparities and polarizations that happens since 2016 and even earlier. So it is not only a public health issue, and it needs the cooperation and collaboration of multiple institutions and multiple parties or multiple key players to work together to actually to mitigate the spread of misinformation and a lot of other associated issues. Hong Kong is actually one of the top 2 or top 3 most educated city in the world, with a lot of with free public education and a lot of top tier universities, but during the COVID-19 still before the large outbreak of we call it the 5th wave, which actually just wiped out quite a lot of the elderly people who were under vaccinated. Even it is very redundant here. So we got supplies from BioNTech, we got supplies from the mainland China for many months that but the elderly people just didn't get vaccinated because of the mistrust. But it's not necessarily the mistrust by the elderly people, but it is the mistrust by their children. They don't trust about the efficacy of those vaccines and others. And these actually resulted in the unnecessary deaths in the elderly home and others. And where their mistrust came from. So we have to examine those issues. So I would say it actually goes much beyond the public health. So we have to work together with communication, political sciences, social scientists, and many other colleagues to work together to find the provenance, to trace back how this mistrust evolved and what are the key issues that like nurtured this kind of evolution of mistrust. And then misinformation is, of course, is something accompanying the evolving mistrust. Thank you, Chair.
Thank you.
Can I just
yes.
add something that in what
Yes.
QP already told, but I think it was also one of the remarks of yesterday's session, but he brought us something very important, which is commonly very misunderstood among the policy debates, is that education, scientific literacy would prevent us from misinformation. And I think the Hong Kong, what QP already just told us, supports the vision that it's not a deficit of knowledge that prevents us to end this deficit of knowledge. It's much more related to emotional, to affective instances, which are also co-produced with the situated political and cultural context. So I just wanted to reinforce that.
Yeah.
Yeah.
In
Thank
fact,
you, Paulo.
this
Yeah,
was
actually, yeah, I'm
Yes.
sorry, just add a few points. Yeah, if we compare Singapore and Hong Kong, both cities are very similar and highly educated. And if we check the scholar citations during the COVID, Hong Kong has some of the most cited public health scientists during the COVID-19. But it's like people here don't actually cooperate as much as Singaporean did in Singapore, simply because of the mistrust issue, which is actually not the scientific level of the researchers here, which is not the government, some other the capabilities of the government and other things. It was actually the mistrust coming from the previous social unrest and the deep-rooted social disparity issues.
Thank you. This brings us to a question. What makes some information more trustworthy than others? To put it in another way, why should people regard information that comes directly from scientific experts and public health institutions as more trustworthy than information that comes from alternative sources? Wibool?
Sure. So I guess there are many factors, right? That why some information actually make more trustworthy than the other. I think you have to. There are several factors that we have to anticipate or check. The first one is actually the incredibility of those sources. For example, if it's coming from reputable or actually reliable institutions, right? Most likely the information should be correct, but coming from my government, I just mentioned that they just totally bomb it, right? It shows something which is not right. And again, you come back to the transparency, and every information should have the clear methodologies, explicitly said or state, right? Where does this information coming from, right? And it has to be evidence-based, right? I mean, this cannot be just come from people look at the crystal balls and say, like, look, it has to be this way and that way. That actually has lots of issue in Thailand. I mean, well, we are not well developed. I have to admit that in Thailand, and there are some very funky and some funny stuff. For example, that at that time we actually unlocked the hemp product, right, which actually can use as a narcotic thing, and people believe that by consuming those hemp or narcotics will help heal COVID-19, which is totally untrue. I don't know why this spread like a Wi-Fi, right? And you have to have okay, come back to the same topic here. Again, most of the information that can be trusted, usually it will be very clear and concise. Okay, and we need to be able to actually deliver that information like a razor cut, right? Do not going on and make sure that people understand in an easy understanding words. I think that's the thing that I like to mention. Thank you.
Thank you. Paulo, when is it reasonable for people not to trust information that comes from mainstream sources?
Yeah. Well, just a comment on
related
the
to
question.
your experience.
Yeah, I'll try to bring that with the previous question. I don't think we should look specifically at the information to assess if it will be trustful or not. I think it depends a lot more from, again, from the people who are receiving that information. Of course, all the transparency, all the evidence-based it's all very important. The fairness, the sound science, it's basically it's where we should depart from. But it's not only that. I think it depends much more on what people really want to see. The objectivity from the public's perspective, it depends a lot on the values that they resonate. If that knowledge, and that I bring to this other question, if that knowledge, it doesn't really matter depending on the context, if that comes from a mainstream institution or if that comes from a garage lab. If that tells what people want to hear, what people want to believe, it's very probable that it will be trusted by these people. And what we have seen in Brazil has been a major campaign to precisely build distrust among institutions such as the World Health Organization, such as the main universities of Brazil, even of world institutions or world periodic reviews like Lancet. People would say that the editors of Lancet were communists, because basically there is one concept brought up by Steve Rainer, which is uncomfortable knowledge. I think when the information is uncomfortable, not only in the individual sense, but also and especially in the institutional concern, it may not be framed as a trustful information. For example, in Brazil, we had a government would deny the severity, the conditions of COVID here. And they wanted people to believe that, to move on, because they were concerned with the economic impacts, and they just wanted people to get back to the streets and work because of the economic fallbacks. And this was very strategic. And so chloroquine, this drug for anti-malarial drug, it became a kind of solution for bringing people back to the streets, back to work, even though it did not work. It was not effective for treating COVID, but it didn't matter for health institutions such as the Federal Medicine Council here. It didn't really matter. What they did was to select information that confirmed that chloroquine would be efficient, and all kinds of even data science based, according to them, that would do meta-analysis from different kinds of sources and bring up what they would see as scientific evidence that would promote chloroquine as the big solution. And this was very strategic for institutional goals, and therefore also with the whole platform, this ecosystem of disinformation among distinct digital platforms. It was precisely what people wanted to believe, and they did believe. It didn't matter where it came from.
Thank you, Paulo.
I'm sorry.
Within 2 minutes, QP, if you can comment.
Sure. So first, like to call back what I just said at the very beginning, that even within the scientific community, there is a disagreement, and the trustworthiness of a piece of information is actually also evolving. And just like Wibool and Paulo just mentioned, different political parties, according to their calculation, they may prefer certain information and certain papers versus another set of papers, and both actually published in reputable journals. So it's really still get down to how you weight the trade-off between economy loss and the health, public health. So when we try to create some models that consider economy loss, so we borrow some equations from the US CDC and the US common calculators. So for a single person stamp, there is a explicit number of how much US dollars associated with it. So it is all translated into the US dollars. So yeah, so it is, I mean, whether you like it or not, but it is one way that we can have a single equation or single model to weight and to see whether we should open or we should like to keep stringent control measures. But from these 3 years, I found that the best tactics was like in Singapore, like the government explicitly told you, this is how we calculate it, and this is why, and this is the rationality, and this is our justification to have this. So even Singapore has those U-turns, you don't have to wear masks, you have to wear mask, and we have to reopen, we have to tighten up. Even the government had the U-turns, but the people still trust it because you explicitly tell them this is scientific facts and this is our concerns. And Singapore is like an international city, it's like a hub of supply chain. We can now keep it forever. Those kind of things. Yeah. So I think so.
Thank you.
Back to what we mentioned, transparency. Yeah. Thank you.
Thank you. That was a great discussion. Thank you for joining our session. Now we will be ready for the breakout, and then we will meet again for 5 more minutes.
Before we go into the breakout rooms, yes, just to echo Mariam, thank you so much to our panelists. This was such an incredible, dynamic conversation to think about the need for transparency and how that can foster trust, and also to think about the relationship with the people to whom we are communicating information, and that being as much a part of building a trusting relationship as well. Thank you so much. This was fantastic. Julia, at this point, would you facilitate the breakout rooms? And I would like everyone in the audience to know we will be meeting for 25 minutes. We can continue to reflect upon and raise additional questions. We will be reconvening in 25 minutes.
Julia? No?
Let's just wait a few more brief moments. It looks like there's others from the other rooms who are trickling back into this group. Mhm. Okay, here we go. So very briefly, I would just like to ask some of my co-organizers to share one or two interesting points of conversation or anecdotes from your respective breakout rooms. Gabriel, you're muted right now.
Yeah, thanks. We continued this line of conversation around different political contexts, especially comparing the US and Brazil, but also bringing in Italy and other countries. We talked about this, to what extent political polarization plays a role in trust or distrust or mistrust in science, and it's an ongoing conversation, obviously, I think it was very interesting, and also an invitation, I think, to think through this in more detail, also maybe counterfactually, and imagine a reverse situation. For example, a far-right president in a country would promote heavily vaccines. How would it look like? Is it even possible? Those kind of scenarios.
So if I understood you correctly, you were talking about the role of partisan politics in the creation and maintenance of institutional mistrust.
Yep.
Yes, that would be interesting also comparatively across different political contexts as well, since those fault lines, are not the same everywhere, obviously. Very interesting. Janelle or Marco, would you share something from your groups?
Can you go, Janelle?
Sure. So we started by discussing the idea of public trust in science, and that science doesn't always trust itself, but also doesn't always trust the public, and how those are really complicated in interactions. And then we also engaged with how understanding messages and making health decisions is so driven by values and beliefs rather than just neutrally assessing the quality of different data sources. And we thought a lot about why people were resistant to COVID vaccines, but not similar treatments or taking medications more generally. And in thinking about that, we discussed the importance of control, agency, and urgency. And in particular, that people want to feel in control and that they can make decisions based on their own perspectives. And that there were some challenges around that with vaccines in particular, for instance, like the feeling of being mandated to do something.
Awesome. Okay, wow, we are right on time. At this point, what we're going to do is we are going to take a 10-minute break, go to the bathroom, drink some water or some beer if it's that time of evening for you. But we will reconvene in 10 minutes. I really hope that everyone here will please stick around for the second part of this meeting. We have a really exciting panel on the topic of conspiracy theories and controversy, which should be really interesting. Again, I would like to thank our panelists, QP, Paulo, and Wibool, especially for sticking around for the breakout rooms. That's so great. Thank you for the opportunity that you've given us to allow us to interact with you and to continue this conversation. It speaks to the integrity that you bring professionally, but also personally to these issues, and I really appreciate that. And thank you, Mariam, for moderating the conversation.
Thank you.
Okay, Julia, why don't we, at this point, Julia, we'll move everyone back into the waiting room and we will reconvene at 10:30 on the dot.
Thank you so much, Melissa and Maria. Thank you.
Thank you all. It's been great.
Thank you.
Fantastic. That was awesome. Miriam, you slayed.
It really was something else. It was something else.
Yeah. Now, Julia, could you please let Anna and Bernadette back in?
Yes.
And Paulo, no?
And Paulo, please.
Okay.
Thank you. Really, that was energizing. That was great. And the breakout sessions were also engaging. Well done. Okay, Anna, Bernadette, welcome. Hello.
Hi, hello.
I am going to run to the bathroom real quick, though.
Okay.
The 10-minute break is somewhat necessary. Sorry.
Okay. Feel free to turn off your video. So nice to have you here. Thank you so much. We heard, unfortunately, earlier this morning that Dietram was having an emergency involving his dog and was unsure whether or not he's going to make it today. We're still waiting. We haven't heard from him. He said he'll join if he's able. So we're going to roll with the punches. So it will be Anna and Bernadette. We also have our colleague here, Marco De Loca, who's a medical anthropologist, who we also have Paulo Fonseca, who was just a panelist in the previous conversation. Both of them are experts able to speak about conspiracy and controversy from a critical STS perspective. And so what we think we would like to do is to direct our questions so that Anna and Bernadette have the platform for sharing their perspectives, but that we're also going to allow Marco and Paulo the ability to raise their hands and jump in with responses to some of your comments if they feel like they have something to contribute as well, so that it's not just falling on the two of you alone. Does that work for you?
Yeah, that seems like a great idea.
Okay, great. These things happen, so we're fortunate to have enough experienced people to fill in the gaps. But I think that regardless, the topic matter here is so rich that it's going to make for a really interesting conversation. Gabriel, do you have anything you would like to say to your panelists before we begin?
Hello. Thanks for joining. And yeah, it seems I was looking into my emails because I told Dietram that if he could join even last minute, he was still welcome to do so. It doesn't seem to be the case. So I think we can roll like this. And so basically for anybody, raise your hand, or yellow or brown or whatever color you chose. Zoom hand or read hand when you want to react immediately to something or that has just been said by another panelist. That applies to the four of you, but even more to Bernadette and Anna. And because Marco and Paulo already have this instruction to, because, it's really last minute, so we wanted them to feel comfortable. But in general, it's great if so I have I have a scenario of for the conversation, but if there's something that's really important that you want to add or open up a discussion or even a debate or controversy, you're welcome to do so. And I will do my best to keep us on track. If that's, I'm pretty confident that it will be a great conversation, I think. So the audience yesterday was very active. Today, at least in the first session, it seemed to be a little more quiet. We'll see with this new panel on a different topic how it goes. But so we try to also incorporate some of the questions that people can post in the chat or in the parallel type pad, where people are invited to share their thoughts and ideas. So that's about the audience. And yeah, please remember to keep relatively short answers, but also at the same time,
they might not need you now that there's all this, there's more space.
Yeah, and feel free to, I mean, as I told you before, I will introduce you very briefly, and then whatever makes sense in the conversation for you to bring up in terms of experience and past and current research, you're obviously welcome to do so. I have a little light problem.
Gabriel, when you introduce, would you, let them know who our speakers are, and that unfortunately Dicham was able to make it, and then to introduce Marco and Paulo as our backups, and that'd be great. And
I was asking, because you asked me, Gabriel, but I don't know if you did with Paulo. Do you have Paulo's bio?
Yep.
And Marco and Paulo, truly, whenever there is an opportunity to weigh in, I think everyone would appreciate that it would add richness to the conversation. So please don't be afraid to raise your hand.
Sure.
Yeah, sure. There's no like first rank and second rank panelists. It's just like for you guys who just, is in a bit of a improvised contingency plan. I just want you to feel comfortable. I don't put the spotlight on you for something that I have been discussing with Anna and Bernadette, but not with you. So that's the whole thing. But otherwise, feel as you're most welcome to be here.
I'm honored. Just a question. I keep my camera off, right? Or should I keep my camera on all the session? Or
no,
if I jump in, I turn it on. Perhaps.
No, you can keep it on all the time.
Okay.
Yeah.
Okay, we're gonna let people back in from the waiting room, and I think just instead of a recap from the previous session, Gabriel, why don't you just get started? Is that okay? So we'll let people back in the waiting room, or I'll say welcome back, and then I'll hand it over to you. Okay.
Okay.
Okay. Julia, I think we are ready to let people back in from the waiting room.
Great, I'll go ahead and let them back in.
Thank you. Welcome back, everyone, for part 2 of today's event and part 4, the final part of this 2-day session on addressing rising mistrust of public health institutions and the social and political reasons behind those trends of rising mistrust. I'm really happy to see all of you again, and I'm really excited to introduce our panelists for the upcoming session on controversies and conspiracies. On this note, let me hand it over to our moderator, Gabriel Dorth.
Yeah, hi, welcome back and welcome everyone. So I suppose you all know the drill by now, but for those who just joined, so you're welcome to post your questions in the chat, but even more in the type pad that we attach to the conversation. And I hope that some of my colleagues will be adding the link in the chat. Yeah, thank you, Mel. Because we want it to be we want the audience to feel as engaged as possible. We will have the breakout rooms later on to pursue the conversation, and this pad is meant to last longer than the chat that will sadly disappear at the end of the meeting. Again, feel free to ask some questions, and we will do our best to incorporate some of them in this very panel. My name is Gabriel Dort. I'm a STS postdoctoral researcher co-affiliated with the Research Institute for Sustainability in Potsdam, Germany, where I'm speaking from right now, and with the project on trust in science at Harvard University that is led by the Program on Science, Technology and Society and the Data Science Initiative. And I conduct ethnographic research with community engaged in so-called conspiracy theories around especially COVID vaccines and solar geoengineering. I will now briefly introduce our panelists, and you can probably already notice that there has been a little change in the distribution. So first, the announced panelists are Anna Muldoon, who is a co-author of the book COVID-19 Conspiracy Theories, QAnon, 5G, The New World Order, and Other Viral IDs. Before starting a PhD at Arizona State University, Anna worked for the US Department of Health and Human Services for 10 years. Her current work focuses on the rhetoric of evolving conspiracy narratives around infectious disease and biological research. We also have Bernadette Nadia Jaworski, who is an associate professor of sociology at Masaryk University, Brno, Czechia, and faculty fellow at Yale University's Center for Cultural Sociology. Her current research focuses on in-depth cultural sociological analysis and reconstruction of public issues such as perceptions of migration and the cultural sociology of conspiracy theories. Then, as it has been said, our third panelist, Ditram Schöfferle, couldn't make it because of family emergency. So we asked Marco, who is a co-organizer of this event, and Paulo, who was sitting in the previous panel, to join the conversation. So Paulo is, and thank you both to step in to help. It would be great. Marco De Loca is a PhD candidate in Science and Technology Studies at UC Davis. His research examines contemporary vaccine hesitancy through a multi-sited ethnography between the US and Western Europe. And Paulo Fonseca is an adjunct professor at the Federal University of Bahia and at the Institute of Science, Technology and Innovation, as well as in the multidisciplinary graduate program in Culture and Society. I would just shorten it a little bit, Paulo, because you've been introduced before. But his work is in part, and this is why he was invited to this event in the first place, because he coordinates research about the spread of disinformation in Brazil, particularly vis-a-vis the mobile phone app Telegram. So we will start the conversation with, so the panel is titled Conspiracy and Controversy. So we'll get into controversies a little later, but to start with, in the public debate, there's I think, widely distributed assumption that the COVID crisis triggered an unparalleled bloom of conspiracy theories that jeopardize public health measures. So in this panel, we will try to challenge a little bit this assumption and ask, among other things, to what extent the framing in terms of conspiracy theories is relevant, what it does for analysis and for public policy. What is the actual impact of those theories / narratives and what could be done about them. So to start up the discussion, and before digging into more like interpretative conversation, I would like to ask our panelists to tell us about their own trajectory. How, why, when did you get interested in conspiracy theories in the first place? So maybe we could start with Anna, with your background in public health.
Sure. I first started getting interested in conspiracy theories when I started receiving in my email conspiracy theories about work I was doing for the US government around synthetic DNA security and safety. And at one point, my email inbox was flooded with an entire series of questions and stories that I had absolutely no idea what anyone was talking about. So of course my response was to go digging on them. And that has led me to eventually leaving the government to go study conspiracy theories because I could not quite figure it out on my own. And then during COVID, of course, I went back to working in public health because that seemed like a life requirement. And the COVID conspiracies then also filled my inbox. And I ended up writing a book about those to keep myself sane.
Great, thanks. Bernadette, would you like to share your
Well, actually, my involvement was in 2020, around May or June. A family member said, you have to watch this film, this short documentary called Plandemic. And so she didn't even call it Plandemic. She said it's about COVID-19 and it's a really seemingly reputable doctor. And I think it's something that you need to pay attention to. And so I watched the film and got so super interested in it. From a cultural sociological point of view, it's really compelling. So I started to do research on Judy Mikovits, Mickey Willis, who produced the film. And I looked at the second film, The Indoctrination, when that came out in August, and looked at the books that Judy Mikovits had written and made a sort of case study out of this. I happened to be on sabbatical in the fall of 2020, and I sat by the seaside in Croatia and studied conspiracy theories very intensively and sort of came up with my own cultural sociological spin on it.
Great. Do Marco and Paulo would like to, or we move on? Okay. Thank you. Because I asked this because it sort of parallels how, I mean, many people got involved in those debates and those ideas somewhat brutally or unexpectedly during this crisis, right? So we see that in our ethnographic work, that for many people it was new. They were not sort of predisposed to be dragged into those conspiracy theories. So in this process over the last 2 to 3 years, what is it that you've learned, or if you could like mention one, or maybe even better, one perplexity, one problem that you identified that makes you think? Maybe you can try again with Anna.
I'm still thinking because that's a great question. I think the most compelling thing that I have decided watching COVID conspiracies spread, maybe the nothing is ever new, is the ways in which these stories draw on much older conspiracy tropes and conspiracy narratives, some of which we can trace back centuries. And that I was surprised by how little seemed actually novel as I started digging further and further into the narratives.
Thank you.
Yeah, there's a deep historical grounding in this. And what I found most perplexing is that I did an analysis in terms of the narratives being told, what I called the mainstream narrative, which again is not cohesive, it's fractured on its own, and the pandemic narratives, which again were a lot tighter and more consistent and coherent than the mainstream narratives because there were just too many things going on. So, but they call upon the same binary codes. If science is sacred, data and evidence, truth, freedom, and this idea of awakening, becoming alert and becoming aware of what's going on. And both narratives, both sides, so to speak, call upon the same set of codes to justify the things that they say. And that's something that I found in my research before, but I was pretty surprised to find it here.
Paulo, go ahead, please.
Yeah, one of I'll bring two things that we've noticed in our research that really shocked me. The first one is how much it is a huge market. It's a business. There is a lot of people making a lot of money with that. Bernadette just mentioned the pandemic. If you see the pandemic, it's sold and there is products and of course there is the monetizing of the distinct digital platforms, YouTube channels. So what we see in the Brazilian environment are some entrepreneurs. It's seen as a kind of entrepreneurship of conspiracy talking. And another thing which also resonates with what Anna and Bernadette just brought is a tactics of how this information, it must be visible but not too much visible. I mean, it's given as if it is the individual, the person that would discover from its own research. So it's usually not that on the main face of the websites, or it's given as if someone would think that, oh, I have discovered, I have done my research. So it's not something that someone told me. It's myself that have been able to find out the real truth, like Bernadette just told us.
Thank you. It opens up. Yeah, Marco. Yes, go.
Just very briefly, like kind of going off of what you were saying, Anna, about the history of this. It's just really a methodological point because, like, for me, I've been working on vaccine hesitance since before COVID, really, all of the duration of my PhD in the US, which is really long, not like in Europe. So before COVID, I was talking with these people. And yes, I see what you're saying. I think it's true that these rhetorics have a history that go as far back as humans started telling stories about each other. That's the case. But also, I don't want to say nothing is new, nothing is happening, it's business as usual. There are changes that have happened that are macroscopic. Like one can see them in the course of really 5 years. It's a discourse that expanded and connected in unexpected ways. Just food for thought.
So just picking up on this, because I mean, there's a lot already to discuss in what you just shared. Thank you. Do these theories, if it's like nothing new or something has changed, or do these theories or statements or positions in the world, do they have a direct impact on behaviors, for example, on vaccine refusal or other resistance against public measures? So because it's what we assume in general, but I would be curious to know more, like also methodologically, how do we measure it? What kind of can we go beyond correlation and to assert that these theories or narratives pose a real problem or a threat. Maybe you can start again with Anna for the sake of coherence.
You have to start with someone else next time.
I will. I promise.
At least in some cases, yes. So there are some case reports that are pretty well documented that we're doing some research to try to identify the temporality of effect around the spread of misinformation around particular sanitary practices. So cleaning of food or cleaning of surfaces early in COVID and calls to poison control. And it's quite clear from that data that the effect is consistent and direct of the spread of information on various social media platforms, and then relatively soon increases in calls to poison control about those specific cleaning agents, right? A few friends of mine did very good work tracing that around some extremist movements, right? That the spread of particular conspiracy theories has direct relationships to action. January 6th is the easy and obvious example because we have so much data. So yes, I think in many cases we can in fact show to reasonable standards of evidence that there is a direct relationship between misinformation or conspiracy and behavior.
Okay, thank you. Bernadette, would you like to?
I would agree. I would tend to agree. Of course, not as a qualitative social scientist, I look at strong correlation and get very excited. I mean, actual causality is pretty difficult, but there is evidence and there are people who work on that. But the strong correlation between like having a film like Plandemic go viral and then the number of people willing to get vaccinated, there was a definite correlation on that. And I think we can take something from that. I know that just personally, I mean, I'm, not trying to introduce anecdotal evidence, but just because I respect my family member who introduced me to the film, I didn't begin to question myself, but I said, it's worth looking into, out of respect for her. And I don't know how much that happens or how much people just dismiss misinformation or, don't take it that seriously. But I think that things like that go viral in our contemporary society that move with such unprecedented speed surely have an effect on action.
Great. So, so in that regard, Paulo, please, I didn't see your hand, sorry.
No, okay. Just to bring another case we were just talking about in the breakout session. In Brazil, we had 95% of coverage, vaccine coverage from distinct from distinct diseases. We had eradicated tuberculosis. We had eradicated distinct kinds of I don't know the name of sarampo anyway. But with the spread of the disinformation on vaccines, we had seen our coverage fall to levels of 60, 70%. So as Bernadette said, I'm also a qualitative social scientist, but I think from this perspective, it's very difficult to deny that this implies in serious modifications in people's understanding of what should they trust and do. So I think it's hard to deny that.
Thanks. So maybe let's move more to the dynamics of those ideas and theories, and maybe just picking up on something that you said before, Paulo. Do you see like a difference between production of those theories and the reception, as it was like especially illustrated in Bernadette's story. You know, it's worth looking into it. And then sharing is sharing a mode of production as well, or is it? So how do you see that in your research? Because it's in a way it's easy to pinpoint some producers of conspiracy theories. I don't know, Alex Jones in the US or the Kremlin propaganda. I don't know. But then when people suddenly turn to those alternative sources of information, it's less clear. And is it sudden? Is it, you know, is it compatible? Can we listen to those alternative sources and to CNN or I don't know, La Repubblica in Italy? Does it make sense? And maybe this time we can start with Bernadette.
Well, I think that there's so much information out there that alternative narratives, as I call them, or conspiracy theories, or however you want to label the alternative type of knowledge that comes out, is so available that you have many, many more people, even like myself, as convinced as I was that I would get vaccinated, begin to look at things. And for me, it became a scientific project. And I think the uptick also in people saying, well, I'm doing research, you know, and this is very common for people to say they're doing the research, and it's an individual online with probably somewhat of an echo chamber effect doing this kind of research. So I think that the line between production and reception, and every time you forward something, of course, you engage in production, is very blurred.
Thank you, Anna. And we'll get back to this in a moment. Yeah.
Yeah, I think I agree that the line between production and reception is fuzzy in conspiracy narratives. I in some of my projects have been referring to this sort of as an almost recursive evolutionary process, that a narrative will show up in a space, someone adds to it, it moves out of that space, returns with an addition, someone adds to it, it moves into a different space and comes back with an addition. This has been particularly true in some of the very specific Telegram channels that I follow, but that kind of group narrative production and alteration sort of makes this cloud of narratives spiraling around each other that interact and recombine and turn into new things. Now, some of those are, as Paulo noted, clearly pushed by the grifters, and sometimes those kind of gain more prominence because those people have put a lot of time into building a large platform to make money off of them. But even those still go back into the less well-known spaces and keep evolving with additions from other streams.
There's a little bit of a tension in your two statements, not that they are contradictory to each other, but between an individual doing their own research online and something like a community, maybe a new community that they join while they discuss those ideas. And I would like you to comment a little bit on this. What is the importance of these communities, even if it's like online communities, but not only online? And between individualism and community, and because there have been massive shifts in communities, some people stop talking to their family, for example, to join another type of community.
I think that absolutely is a tension that also exists sort of in conspiracy land, right? Between individual research and community coherence within conspiracy communities. but in so many ways, that individual research is the performance of evidence as a process to sort of maintain your space in that community. And it's individual performance of a community norm.
Very well put. The tension between the performative, I mean, the term that I coined when I did my analysis of the case, the pandemic case, was performative conspiracy. I mean, it's always being performed by the individual, but as you say, there's always community norms. I mean, as a sociologist, I know the importance of this kind of thing. So I think it's really important that you brought that up.
So to what extent, I'm coming back to this idea of production and reception, but do you think that these individuals can contribute and shape the narrative, or they're just echo chamber or
absolutely, they shape the narratives. Absolutely. And particular people who gain prominence in those communities, even if they are not making money off it, yes, absolutely, individuals who are very invested can become really influential in where things go.
Okay, I'm asking this because also Mel give me like a question from the audience, and I would just read it as it is, but I think it's connected and helps figuring out how do we qualify those social phenomenon, and then we can talk about how to respond to them if we have to. The question is, if we view conspiracy as religion, would that help us understand that community better and as such better communicate with them? In a way, if people can, I'm just picking up on what you just said, Anna, if they actively shape and reshape the narrative, maybe it's a bit different than a religion, but I will let you comment on this. If you want to continue, or Bernadette, you can step in.
Yes, I mean, so a large chunk of my work looks at how conspiracy relates to apocalyptic religious discourse. So I clearly would say, yes, there are a lot of ways in which conspiracy can be examined as a religious process in some ways with limitations. In particular, there are some people who've had interesting discussions around conversion processes and how those relate to conspiracy theory that are absolutely fascinating and very useful in thinking about the ways that people will leave behind their whole lives to fall into conspiracy. But I think that would create more tension in theories of religion that focus on an authoritative figure as the only creator, rather than the more participatory and communitarian aspects. I should note that I think that conversion process metaphor may apply more into the US or places heavily influenced by US religious tropes than in other places. I think that is a limitation of it.
Yeah, I would tend to agree. Sorry, did I interrupt?
No, I just wonder if you would like to comment also on the European context, for example.
Well, I studied, my case is really the US, but I know just from what I know personally about conspiracy communities, for example, in Czechia or Slovakia or even Croatia, as I was there. I think that the difference is the authority is not anthropomorphized because the authority is science and truth. So that would be a big difference in my view. But so many of the things operate as a religious community does in de facto. And if you go back to people who talk about the Enlightenment and saying that science replaces religion for a lot of people, then that makes sense.
So it's religious both sides. Is what you, or am I pushing too far?
Maybe.
Paulo, would you like to
I'll
comment
say
on
yes.
that? Yeah. That's interesting. Paulo, would you like to comment on this with the Brazilian context, or?
Well, here we have many people saying that it's much like religion, but I tend to agree with what Anna and Bernadette told, that even though we have many features that are pretty much like religious communities, they have some idiosyncrasies, and I think this that Anna mentioned about this participative culture of and bringing back to your previous question of everyone also raising and bringing and shaping the narrative according to what one anthropologist called Van Zonen called epistemology. I think it helped us a lot to understand also that it's not that other source, anonymous source or anthropomorphized source of truth, but it's pretty much how each one just with his own mobile phone produces his own truth. So, but it's also very dogmatic, and also it has many of the features of religious communities, really.
Yeah, I just wanted to share that last year, at least, when you were walking around Cambridge, Massachusetts, where Harvard, MIT, those institutions are based, there were some signs in the front yards saying, "In Fauci we trust," which is clearly a reference to what is written in the US dollar bill, "In God we trust." So in that sense, it's also kind of at least it sounds as a kind of a religious, or maybe more, what's the word? Degraded religious statement. But maybe we could move to, because it's I like that we problematize this question of religious or not, and I would like to bring back the second part of the title of the panel, controversies, and ask, so to what is classically in science studies, controversy is a process through which there is some kind of a knowledge production. There's a problem, there's an uncertainty or an alert that is being thrown by someone, and then there's a debate, further investigation, and ultimately, hopefully, the controversy is deemed as solved, and we learn something along the way. Do you see some kind of knowledge production in conspiracy theories and people who follow them? Would like to step in. Bernadette again?
I would say so, for sure, because I mean, I like what Paulo was saying about the epistemology. So you have this people, the me doing research, right? And I think that what I was going to say, just one more thing on the religious aspect too, before I forget, is that apocalyptic thinking is not the province of only religion, but I think that's where it really shows up, and that's where the comparison can be drawn. But in terms of controversy, I mean, the claims that people make for, like in the pandemic case, that big pharma's got ulterior motives, or that media can be corrupted and report in a sensationalist way, are not that controversial. That's why it's so compelling in its plausibility. because there are actual conspiracies that have been unleashed. I mean, from Watergate to Iran-Contra to the tobacco companies suppressing research. And that's what makes it so tricky too, so I'm not sure that I necessarily say that in the case that I studied anyway, that it was that controversial. They're saying things just in a more extreme fashion that many people tend to believe about the media, about big pharma, about Western medicine.
And also some people just heard of it during that time, right? They had never questioned, for example, the power of traditional medicine or big pharma, and they started to can we say that they learned something out of it and they make them more critical citizens?
Well, I'd like to think so, because I'm ultimately an optimist. So I think that any kind of engagement, civic engagement, that can add to knowledge, civic knowledge, and knowledge production is not an entirely bad thing. On the other hand, you have disinformation and a lot of danger with that too.
I think that there are forms of knowledge production happening in conspiracy communities that in some ways are kind of an introduction to power politics for some of the people that are in them, which is interesting to watch, at least in the US at the moment, also possibly somewhat dangerous, given the leanings of those introductions. But I also think that there is a way in which some conspiracies, I don't think I'd go so far as to say all, are stories about power or things that it is not easy to discuss publicly in the societies in which they are occurring, or at least in the specific cultural context in which they are occurring. So they become an outlet to tell stories about, for example, class in the United States, where we just don't talk about class as an object that exists. And they become a way to express some of that without actually using the words that have political connotations that people don't want to deal with. You can tell that I'm not 100% sure that I truly believe all of that, but that's where I would lean, that there's more going on there than just knowledge. There's also the building of a social story happening in these communities.
Yeah, I asked this question because I think it makes a big difference to look at those people and communities in terms of what they are building. Whether we agree or not, it's not really a question here, at least to me. Rather than looking at them as deficient in a way or another, lacking of knowledge, as Paulo pointed to in the previous panel, what is classically called in social sciences a deficit model. So it's people who don't disagree or don't follow the rules or don't vote like we would like them to vote. It's because they don't understand. So we have to explain better. But here it becomes, I think, difficult to just explain better what has been explained many times, sometimes badly explained, but the divorce sort of is somewhat consumed, I suppose. So we could, oh yeah.
Can I just twist a little bit, Gabriel, your question?
Yes.
I think this relationship between the controversy studies and conspiracy studies is very important because we have, from the STS perspective, we have many methods and concepts that have brought us here to understand the knowledge production. And for instance, if you look at one concept of boundary work, I think what conspiracy theories do is pretty much what the STS community has studied from distinct scientific controversies, which is boundary work. They're basically competing for one or another distinct understanding of who should be authorized as scientists or true, or what should be authorized as truth. And I think it's very important to dig into these understandings and see where specifically are the difference between the distinct models of science, because usually there is in the conspiracy model there is some point in which it becomes very dangerous, usually some loosening from standards of minimum evidence base, for example, but with a lot of plausibility. It may help. I totally agree with the colleagues here. I think it may be a good way to recognize critical thinking, but we should be aware of the kind of scientific understandings that are behind that, because usually it turns to some visions of science itself that do not deny science, do not deny the idea of the authority of one truth that should we all be aware of, but usually responds from particularly dangerous points of understanding truth, I think.
Thank you. I think it's great, and these last few minutes sort of respond to questions that were texted to me by Mel from the audience without really asking those questions. So I think it's great. And I would suggest that, I mean, the logistic behind this, the group, the team is absolutely awesome. I want you don't see it, but believe me, what's going on behind the scenes is really great. It's a pure like conspiracy in itself. We are breathing together. I would suggest that we spend the last like 7 or so minutes that we have to think more like forwardly and what could, should, or be done about this, or how do you think this? So we are like basically social scientists, and I know very well that we usually are not very comfortable with prescription, at least in this type of interpretative social sciences. But still, let's try to just explore some aspects of this question that I think is still very important and legitimate to ask from people, for example, in the audience, coming from a more of a public health background. So maybe we can start with this distinction of narratives that you, Bernadette, brought up and you study in your research. So is it also social sciences incapacity to complicate and these narratives and to bring up new narratives, or is it something that could be done? Or should be done by social scientists, do you think?
Well, I think that the awareness that even though you have completely different narratives, one that starts out tragically and because there's a conspiracy behind it, and ends apocalyptically because millions of people will die from a vaccine, for example. That narrative at the same time as the other one has a romantic ending where if we follow the rules, wear masks, get vaccines, it's going to be okay.
Yeah.
But they both draw on the same kind of sacred codes and these civil codes. And that's, for me, at least some kind of a little bit of an entry point into dialogue. Because if people realize they're drawing on the same things, it's just a matter of the boundary work. I think everything's about boundary work. So of who is a scientist, who is a trusted scientist, what the truth is. But the realization that people are drawing upon the same set of values and assumptions is at least a starting point.
Thanks. Anna, would you like to step in?
Yeah, I think values-based communication methods are probably the best bet for group communication. And there is already quite a bit of research out there in public health communications on how to do values-based communication around public health for the public health people who are here, that I think is very useful. I think one of the things that we often miss when trying to prevent the spread of or combat existing conspiracy theories is that they are compelling stories. They are incredibly compelling stories. And I know in my scientific work, sometimes fail to tell the compelling story about what I am doing and why it matters, because I've done cool science and I just want to talk about the cool science, right? And I forget the story. And I think that is one of the broader problems that I'm not 100% sure how to fix, because those stories need to connect to people's values, connect to how they think of themselves in their communities and what these conspiracy communities are helping them find in the world that clearly some of our scientific systems are not. So yeah, much more work to be done about good storytelling around what in my other life I as scientist do.
Anybody would like to add something to this? I mean, yes, Marco, please.
Just very briefly, I think something that is important is to allow these stories to interact with what I think is their intended audience, that is scientists and research professionals, and see how these stories change or could change the way research is done. I think that in that, or change, yeah, morph, adjust. And in that sense, I think that, to go back to your previous question, there is a knowledge in it, in the sense that there is an idea for making sense of things. And in that perspective, I can think of a way these stories can live with us and we can live with them without making it into something that must disappear, because it's not going to. As of now, I don't see it going anywhere. So what we need to do is, and to me as a researcher, is the most compelling question, devising ways to live with this. And in that sense, yeah, what I want to see is a science that is able to interact with this.
Thank you. Thank you, Marco. I think it's a very good complement to this problem that we're trying to puzzle out. And we will not solve the problem today. Of course, we have 1 to 2 more minutes to go. I would like to just circle back to the opening question and ask to all of you very briefly, where would you like this conversation to go in a year from now? For example, what would you like to see more addressed, or like new lines of research in the future? Can we start again with, let's start with Paulo, like surprise.
Well, I'd love to see the conversation based on what Anna just told us about value-based communication. I think we have quite clear what are not the solutions, which is try to go back to a kind of positivistic or authoritative approach to that, And so I think we have made some great progress here today. Thank you so much.
Thank you. Bernadette?
Well, I tend to agree. Being a cultural sociologist, our goal is to understand. And this goes back to Max Weber and his idea of Verstehen. But a lot of it has to do is do your science, your research with respect. I mean, people who are labeled conspiracy theorists are not bad people. They're not crazy people. Even if it seems that way sometimes, they're people. And if you have an environment of mutual respect, I think it's a lot easier to start conversations.
Thank you. Anna, would you like to add something? Also very briefly, but we are.
Yeah. I think focusing on figuring out how to tell stories, and Marco's point about trying to see what these stories can tell us about what we need to be doing differently is an interesting starting point to come at that from both sides.
Cool, thanks. And before Marco, you have the final word. I look at the chat, the executive director of CUGH, who's bringing some interesting compliments and information about events to come. Marco, you would like to add something to the new? I mean, we work together on this, so we will see where we are in a year from now.
Yeah. And I mean, everybody said beautiful things. One thing that I think would be interesting for me to see would be a more concerted effort to really get across that debunking doesn't work.
Mm-hmm. Yeah, for
that,
good.
maybe that is a conversation that we actually socially needs to happen and is not happening.
Thank you. So Dr. Martin, do you like to say something loud in
Merci bien, Gabrielle. Thank you very much. Really a big thanks to our research committee and to all of you. I will share with you, this has been something we've been doing for quite a few years, and all of you know that this is one of the top 10 threats to global health, right? So let me come with this to two things if I have a second. One is a politician, as a former member of parliament, and as the executive director of this organization. We have a few big gaps we can interrogate, and working with and thanks Melissa for all your great work on this, and the whole Dr. Wasserheit and Dr. Kilmarks, you guys have been doing great work. A few things. Number one, there's some tools, and as you mentioned, Gabrielle, we worked with First Draft News. They have a number of online tools. Please look at it, take it, use it, and share it. They're very practical tools to the challenges and opportunities you mentioned. Second, please work with us in terms of mobilizing the scientific community to not necessarily become partisan, but certainly to become more politically engaged. What we're trying to do is be able to bridge that gap, right, between the scientists, so we can create more public scientists to bridge the gap, to be great communicators, to share the work, but to understand, as you've all mentioned, what are the incentives, what are the fears? These are not bad people, but they're being often manipulated in ways that are destructive to everybody. So please work with us to look at the tools we're sharing, engage with our community, which is 34,000 people around the world. Work with us, and with your expertise, share with us how we can build, create, and provide tools for people to be better public scientists. And finally, at our conference, we work with the Pulitzer Center for Crisis Reporting to actually share these tools, create these opportunities. And we're holding two things. Number one, a film festival where we bring documentarians in, and the short docs on big global health problems. But at that, you'll learn actually from their perspective how to communicate, how to tell those stories powerfully and visually to create not only, address people's minds, but importantly address their hearts, because emotional responses have a bigger impact. And then on day 3 of the conference, on the 16th, we have a training workshop with them on communication. They're both free, and so please, if you're attending the conference, please sign up for them and work with them and our partners to do this. Sorry if it took a bit longer, Gabrielle, but really know we're big partners with all of you, and Melissa and Judy and the whole team knows we're there, and we want to work with you to deal with this because this is a long-term problem, right? So again, thanks so much, Gabrielle. Thanks to all of you.
Thank you.
Back to you.
Thank you. Thank you very much for this invitation. Yeah, I think it's very important. We have to think about it for sure. Thanks. Thank you to all of the panelists, improvised and planned panelists. I hand it over to Melissa for the next step.
Yes, thank you.
Yeah, thank you very much.
This conversation was just absolutely riveting. I felt like I felt like I heard things that I've been dying to hear, but haven't actually heard articulated publicly and so well. It felt new in a way that I'm really grateful for. So at this point, and I would like to thank Keith for joining this session and for sharing those resources. Before the session ends, I will provide links to those resources that Keith mentioned. But for now, let's ask Julia to put everyone in the audience into breakout rooms. We invite our panelists to attend these breakout rooms if you would like to interact more directly with the audience members. We will have opportunity to raise additional questions and comments. We will meet for 20 minutes and then we will reconvene to close out the session. Julia, would you mind putting us in breakout rooms? Okay, let's just give a few more moments. It looks like the others from the other breakout room are not here yet, but we'll be trickling in momentarily. Okay, welcome back, everyone. Let's just take a few more moments before closing out the event for today to share some of the insights and some of the anecdotes discussed in the different breakout rooms. Janelle and Marco, would you care to start us off? I think you're muted, Marco.
Yeah. I think I can go. It was a fascinating conversation. I'm going to try my best to summarize it. One thing that came out from that we were able to talk about was the notion of virality and whether or not it works as a descriptor or as an epistemic for talking about conspiracy theory. Especially in relation to what both Anna and Bernadette were saying earlier. And Paulo, please jump in if you feel that I am simplifying what you said too much, but focused on the role of the digital infrastructure in shaping the view that one gets of the world. From really their digital media. And in relation to that, we stress the importance or the power that the injunction to critical thinking exerts on people that think conspiratorially, and therefore how only selectively virality works for explaining their relationship with information. But I'm skipping the first part of the breakout room where I wasn't there. Maybe Janelle, you can.
Yeah, absolutely. I think that actually the conversation we had, the first part, really fed nicely into what Marco just discussed, because it was really a focus on the role of storytelling and how powerful storytelling is, right? And then thinking about how we can bring people to the table, like artists, film creators, like creatives in general, and how we can build narratives that think about values, that think about ways of knowing that go beyond just the idea of like a knowledge deficit, right?
And then Ijoma asked an important question, that is, okay, if it is true that debunking doesn't work, what does? And it was complicated to address it. But I think that something we all agreed was that what matters is finding ways to stick together, no matter if people think differently. And that was maybe one big takeaway. And then in the last minute, I had a good idea of asking everyone how they feel about the word conspiracy and conspiracy theory, whether or not conspiracy is a good word for this. And Bernadette was just beginning to get into it, but then we didn't have enough time.
Mariam?
As well, there was discussion on to promote the critical thinking in people so that they can be more informative and they can decide on their own freely.
But isn't it already the case? I mean, to just connect with something that we discussed in our breakout room, there are some good reasons also to dive in some parts of conspiracy theories. So it's difficult to draw the line between critically informed engagement in controversy and a conspiratorial understanding.
Yeah, I mean, that not to be STS, but that is, I think we talked about it. It's the Latour piece. It's the West Critique ran out of steam. That partition is fuzzy. It's really in the air.
Yeah, I mean, it's an open question, right? But it's
whether it's the Illuminati or international capitalism, and you're a Marxist.
Yeah. Yeah, political theory, both sides, right? But with different tools. Yeah.
One thing that we talked about in our group, in addition to all of the things that our co-organizers have just shared, it seems that we discussed similar things in the other breakout room. But something else that we discussed was to remember not to just take conspiracy theorists or people who create, promote, or receive conspiracy narratives as a monolithic group in and of itself, that there's also nuance within this. And what that means is that we can look at some types of conspiracy theorists or some ways. Sorry, let me say that again. We can look at conspiracy theorists, some of them perhaps as becoming critically engaged in a unique way, becoming more critically engaged with social and political issues, and in a sense acting like citizens who are involved in or who care about the state of things within their national context. But at the same time, there are some who may have more nefarious agendas or who are spreading conspiracies or disinformations that can be really harmful, not necessarily to everyone, but that can be targeted to some groups as well. And so I thought that was a challenging thing to wrap my head around, but I think also very valid when we think about this space moving forward. So with just a few minutes left, I want to share a slide of some key takeaways from our session today. Okay, so over the course of this past 3 hours, our first session on COVID information in institutions, and the second session on conspiracy and controversy. I think some of the themes that we heard throughout was that distrust of science, and I think by extension, distrust of public health, does not come from misinformation. It can be exacerbated by it, but really at the root of mistrust and our social and economic inequities, and also differences in social and political values. And so if we want to address the problem of mistrust moving forward, we really need to address some of the systemic issues that are driving increased trends of mistrust. We also heard that, and this is the other side, one side of the same coin, that mistrust of institutions and the way that can translate into personal decision-making related to health issues, such as whether to take a vaccine or to wear a mask or et cetera, often has less to do with knowledge deficits and more to do with values, beliefs, and attitudes towards power. Now, this is not to say that has nothing to do with knowledge deficits, and in certain contexts, of course, like educational campaigns could be very useful and important tools. But when we think about how to address this moving forward in the global health community, we shouldn't just limit ourselves to methods and strategies that have worked in the past. We need to think a little bit more also beyond that and more holistically, again, to get at the root. And the root might not be, oh, people don't know. They might know differently, or they might feel differently. And so, and it maybe it doesn't have anything to do with knowledge itself. It just has to do with attitudes towards authority or established institutions. So we want to take that into consideration as well when we think about this problem moving forward, how to research it and how to respond to it. We also heard that conspiracies aren't going anywhere. And also because of the virtual communities pretty much everyone participates within, likely the spread of information or mis and disinformation, that's not going anywhere either. So if we want to understand why people are attracted to conspiracies or why people are receptive to alternative sources of information, then we are obligated to take those people seriously, to take people who believe in conspiracy theories, to take people who prefer alternate sources of information, to take them seriously and not to ridicule them. Because if we ridicule them, we just further polarize them, which can be threatening to global health efforts, but it also doesn't enhance our understanding of the problem to begin with. And in that sense, it delimits in advance our ability to respond adequately to it. Counterintuitively, also, it was suggested that conspiracy narratives might actually be helping in some ways. To an extent, they can help citizens to become more critically engaged with social and political issues. This Anna and Bernadette mentioned this in their panel. But of course, there are dangers implicit in this particular mode of civic engagement that we can also be attuned to. But also conspiracy narratives teach public health researchers and scientists about the value of and the need to tell compelling stories. What makes information or conspiracy narratives go viral is that they're really compelling. So maybe there are things that we can learn about that, how to tell compelling stories ourselves. That leads into some of the ways forward that were addressed today. Marco said debunking doesn't work. This is a provocative statement because there's an abundance of information studies, especially in the wake of the COVID-19 pandemic, and there's a lot of investment in debunking. So this is an open question and a debate, and one that I would really like to continue thinking about and maybe even having at next year's conference. But there, nonetheless, often debunking doesn't work. It can actually encourage people to double down on the beliefs that they already have. And so, what can we pursue? What can we pursue moving forward? Wibool talked about the need for transparency, being transparent, and so did QP. Being transparent about the decision-making processes, being transparent about science, but also in how scientific evidence is informing policy decision, and also being transparent about what is more than scientific evidence, because it's not always that policy decisions are entirely scientifically evidence-based. There also are values-based decisions behind those decisions as well that, although vulnerable, if we were transparent about it, might actually increase public trust in institutions. We also heard about values-based communication to that effect as a way forward, and respectful research with the people who we want to understand and possibly even whose behaviors we want to change. Again, to tell compelling scientific narratives and to counter the spread of nefarious conspiracy and disinformation campaigns, while also maintaining empathy when when possible and as relevant to alternate ways of knowing and being in the world. I want to share that slide, and I would also just like to take a moment to invite some of my fellow co-organizers and some of the panelists, if they like, to add any key takeaways that may not have been on my slides. And if not, that's okay. Go ahead, Gabriel.
Yeah, there were clapping hands.
Okay.
Yeah, it was a great job.
Okay. Truly, I would like to give my deepest thanks to Mariam and Gabriel, our moderators today, and to all of the panelists from earlier and from our earlier session and from the second one. I said this in the breakout room, but I truly feel like something magical happened here today. I was challenged to think about these issues in ways that I didn't necessarily have the vocabulary for doing so before, or the breadth of perspectives. And I hope that everyone in the audience feels the same way, but I really learned a lot and have so much to continue thinking about. Let me just share one more thing. I put my email address on this slide. If you are in the audience and you would like to continue engaging with me or with some of the co-organizers here, please reach out to me at melsalm@gmail.com. This event is the second in a series. We hosted an event last year on a topic, but we reframed it a bit differently. And so we incorporated a lot of the lessons that we learned from last year's session to this one. And we're very interested in doing the same next year. This is an ongoing conversation, and these problems continue to evolve. And we would like to invite you to continue speaking with us and each other about how to research this moving forward. And so on that note, for real this time, thank you. Thank you so much for attending. I hope you enjoy the rest of your days, afternoons, and evenings, wherever you are.
Thank you.